This video will cover Part 1 of Chapter 6, Health Psychology for PSY 120, Careers in Psychology, Neuroscience, and Human Development. Health psychology is an applied area of clinical psychology which involves the study of psychological influences on health and is especially focused on those interactive elements where psychology, behavior, environment, all of that impacts human health, the development and treatment of illness, as well as wellness. The assumption is that our thinking, our emotions, our actions, our social lives can all influence how we feel. And I think that's pretty intuitive. We all know that the way we think, the way we act, the way we process emotions has impacts for us in terms of how we feel, but also can have impacts on our health, our physical health, and the way we respond to states of illness. Health psychologists, therefore, are really specialists in that mind-body connection, and the applied element of it has to do with the ways in which the psychological understanding of health and wellness can be applied to helping people to have the healthiest lives that they can. Now, your authors provide you with a whole long list of research questions that health psychologists may be interested in answering. I'm not going to cover all of them, but the themes that you can see here are sometimes very specific, like how does mindfulness meditation, which is all the rage over the last decade or so, how does that impact chronic stress? And indicators like blood pressure. What are the impacts of chronic stress exposure during key developmental periods of time? How effective can various kinds of interventions delivered by mobile apps be? That question is going to become even more and more important as we're seeing the application of artificial intelligence models to provide actual mental health care. I don't know if I would call it that at this point. It's still pretty spotty, but how good is it at making people feel better? How good is our AI-driven mobile apps at providing people with prompts to live healthier lives, like to monitor their blood sugar or monitor their intake of their medications and so on? Questions about social media influences, questions about various types of therapeutic interventions that can be applied to helping people to manage conditions like hypertension or diabetes and so on. So there's lots of questions that really sit in this intersection between medicine and health and psychology. Any healthcare professional will tell you that it is critical that they understand how people are making sense of information, how they're managing their emotions, how they're navigating changing their behavior such that it can improve their health outcomes. So health psychology is really, really relevant. Now, rehabilitation psychology is another area of specialization. It's not the same as health psychology. It's very focused on helping people who have disabilities, who have chronic health problems, to deal with and manage those changes. So, for instance, let's say that you have somebody who has MS, multiple sclerosis. That's a chronic health condition. It's also a neurodegenerative condition. So that person is going to have a lot of physical challenges. They're also going to have some emotional challenges that impact everyday life and independence. The rehabilitation psychologist may be someone called upon to help design treatment approaches that can help that person navigate the process of that disease. They can also be found working to help people to rebuild abilities that they've lost. So let's say you have someone who has had a stroke or a traumatic brain injury of some kind. The rehab psychologist may be brought in to do assessments to determine the degree to which they can recover function. over time, and then provide programs to help them to recover those abilities, or to find workarounds. So the goal of rehabilitation psychology is help people regain function, or gain new functions that help them to live independently for as long as possible. So they're going to focus on people with health conditions. It could be short-term, acute conditions that have arisen suddenly, or they could be chronic conditions. So you can have someone with heart disease who needs rehabilitation after, say, surgery or stent implantation in order to change their behavior to make it more likely they can live independently. Managing chronic pain, managing neurological disorders, all those kinds of things. The rehab psychologist is going to look at the whole person in terms of their psychological functioning, not just emotion, but also their sensory, cognitive, and physical changes that may be brought on by illness, injury, or other factors, and then build programs that can help people to recover function, to build new patterns of behaviors. They'll also, given the psychology element, they will work to help people to cope, to manage stress, to manage their emotional reactions and well-being. Because for a lot of injury, illness, chronic conditions, neurological conditions, brain injuries, the psychological impacts like anxiety, depression, and trauma can be just as debilitating as the illness symptoms themselves. So the rehabilitation psychologist is going to work holistically on all of that. And what are some of the research questions that rehab psychologists may be interested in? What kind of cognitive emotional factors, what kind of support systems are positively related to adaptation when people have disabilities? How can technologies, assistive devices, artificial intelligence be involved in treatment of chronic conditions, pain management, etc.? What are effective strategies for managing pain that are non-addictive? What strategies are most effective for helping people with disabilities get jobs and support themselves? What kind of vocational rehabilitation is best for what kind of specific needs that people have? All of these are the kinds of research questions that rehabilitation psychologists might be interested in. Medical psychology is probably an area that you've never heard of. I wouldn't say that it's a common specialization. Health psychology is becoming much, much more common, as is rehabilitation psychology, particularly as we have an aging culture. Medical psychology is a very specific application of psychological principles to medical settings, so specifically in the medical setting. So the focus has tended to be on assessment, diagnosis, treatment, and prevention of psychological disorders that are associated with health conditions. So, for example, a medical psychologist may be involved in providing treatment services for cancer patients specifically, or for people with neurological disorders like Parkinson's or Alzheimer's specifically, or people with cardiovascular disease specifically. So in some ways, there's an overlap with rehabilitation psychology. Rehabilitation psychology really kind of targets in on functioning and making it so that the person can be as independent as possible. The medical psychologist is more focused on those emotional symptoms, the emotion, motivation, psychological distress that's associated with severe or chronic health problems. These are psychologists who are more likely to be working in hospitals and clinics or in private practice, and they're going to be embedded in medical care settings. They're likely to focus on things like stress, anxiety, and depression, which can impact the course of illness and influence recovery. Medical psychologists are going to be engaged in building programs or interventions and then implementing those interventions to help patients manage illness and deal with their symptoms. The overarching goal, unlike, rehab psychology is really targeted on those independence-related skills and abilities, whereas medical psychology is more about enhancing quality of life in the progress of, or the progression of, this illness. They also serve as people who can communicate between patients, families, and medical professionals. So in some cases, they're helping patients and families to understand better in more grounded terms what the things their medical professionals are trying to communicate to them and do so more effectively. Some research questions that people in medical psychology may have, things like how do interactions with medical professionals influence outcomes in hospital settings. I have a concrete example. I was communicating with a doctor's office and with, one step removed with a medical professional, and the interaction was very terse and impolite, and it made me angry that I couldn't get the information that I needed. In another case, I had a friend who was a patient and called in to a doctor's office and was given some very devastating news about a blood test that had long-term ramifications, and the delivery of that was kind of just, here's your bad blood test, end of phone call. What kind of impact does that sort of callousness have for medical outcomes? In contrast, if you have high quality patient interactions that show empathy and care and concern, would you have better outcomes? Other kinds of research questions: what are the needs of people who are dealing with terminal illnesses? What do their families need? How can those needs be addressed so that people can move along that process in the most positive and healthy way possible? What are side effects of long-term medical treatments? So what kind of psychological impacts are there of chemotherapy? For example, a friend of ours had, actually it's my cousin's, someone related to my cousin who has leukemia and was going through treatment. It's just really, really hard process of treatment. What are the long-term impacts of those kinds of medical treatments? And in terms of psychological side effects, like what's the impact of really worrying about every year going in for those scans to see if you have had a reoccurrence of your cancer? That can weigh on people. What are the psychological effects there? What kind of psychological factors are influencing end-of-life care and decision-making, and so on? And you could extend that out to the family members as well. So that concludes part 1 of chapter 6.